I'm Dr. Chariar. I have a veterinary clinic in Thane, Maharashtra. We have been in the veterinary service industry for the last 20 to 25 years. As a childhood, I had a lot of pets. I grew up with pets at home, and as early as 10 years of age, I decided that I wanted to become a vet, and I am very lucky to have realized my childhood dream come true. I have had dogs, not so many cats. Once in a while, my cats were never in house, they were always used to come and go. And I had birds, parrots, that's it, but lots of dogs. So after my 12th standard, I joined Bombay Veterinary College for my bachelor's degree. I did BVSc and AH. Then I got into masters. I did surgery from Bombay Veterinary College. After I finished my bachelor's, I used to work with one of the very senior vets in Mumbai. I worked with him for almost two to 3 years till I finished my master's degree, and of course immediately after my master's I had my own clinic that was set up, so I was working there. We started from our bedroom. We used to see pets at home, so our bedroom used to double up as a clinic. We used to have consults there. That time was a very lean time. We didn't have so many patients, obviously a young startup practice. So maybe if we had 4 patients a day, we used to be very happy. Okay, yeah, we got so many dogs today. So maybe once in 1 week or 2 weeks, we used to perform surgeries also. We used to perform surgeries for some NGOs around Bombay and some other veterinary practices in and around Bombay. So that used to be another thing that we were involved in. Back then, a long time ago, we used to do a lot of wildlife work. Even today we do a lot of wildlife work. A lot of wildlife NGOs do get their animals here. But then we used to go to certain places and do surgeries if required on wildlife as well. Then from our bedroom clinic, we graduated into a small one-room clinic, a commercial place. From there we became much more bigger, and now today we are having a 5,200 square foot big facility with all sorts of radiology and hydrotherapy and ultrasound, all the facilities that you need, laboratory here under one roof. Now you have several setups where we do have all the facilities in-house under one roof, but when we first started, even drawing a blood sample and getting it tested used to be very difficult because there were no veterinary pathologies around. So we used to go to human pathology labs and ask them if they would do the samples for us, and then slowly we started having some tie-ups with our local human pathology labs. They used to do samples for us, and then slowly over time the veterinary pathology instruments also came here in India, and we were we got for ourselves, and we started doing our own pathology tests. So blood work, cytologies, histopathologies, everything on the veterinary side is very much available now. That was not available 20 years ago. So like I said, now there are a few setups which have all the facilities in house, but there are several more small setups still which do not have laboratory or ultrasound or X-ray. So in my clinic I do have all these facilities. I have laboratory that does blood work, I have X-rays, I have ultrasound, I have a hydrotherapy unit where you have physiotherapy available. Then I have my OT is the most specialized area of my clinic, where we have laminar flow technology. We have a C-arm for orthopedic surgeries, and we have laparoscopy and endoscopy set up. So obviously both of us are surgeons, so we tend to do much more surgeries than any other regular medical facility would do. So we invest a lot of our we invest a lot of our energies into surgery, and we do a lot of surgery all the time. So recently we did do a surgery on a dog, on the spinal cord of a dog. He had a small tumor growing in the spinal cord which was denting on the spinal cord, and he was not able to walk. So I think it's been almost 7 to 10 days since we did the surgery, and the dog is already walking, which is a great thing for us and obviously for the dog and the owners. So they are very happy about it. So obviously a clinic means there are going to be sick animals coming in, dogs and cats who have some vomits or loose stools, or who is having difficulty urinating, they might pee blood or things like that. So you would expect the clinic to be really messed up, but we take, my staff is working all the time to keep the premises clean. So yes, do my patients vomit and poop in the clinic? Yes, it can happen, they are sick animals. So then immediately it has to be cleaned up. We take precautions like, we sterilize the premises every night before close down. Particularly in COVID times, we have started to follow that more rigorously, and cleanups, moppings all the time. After each patient has gone, wash your hands, clean up the table. Those are the things that we have to follow. That's basic hygiene rules that we do. The basic thing that we look for when we are going to employ anybody is whether that person is kind towards animals, how well he can handle an animal, how kind he is, how happy he is to handle, and only then we take them up, because working with animals is not everybody's cup of tea. So that is the basic thing. And then of course, as we see them work, we find that yes, they are okay, then we promote them, or we give them some benefits. In general, the environment of the clinic, we try to maintain a happy place so that they are also happy, and then the best efficiency it comes forward. I also have to say that working with animals is in itself a very stress-free experience that anybody can have. So that is also one big plus for me, that anybody who loves animals naturally is very happy here. The only problem that can happen with the strays, if let's say if I'm a feeder and I'm feeding a particular group of strays in my building, those strays can be very protective about their territory, and for some reason some of them can start behaving aggressive towards others. That is the only problem that we face all the time. I would rather say that don't feed the stray dogs in the complex. Like the municipality has been very clear recently that even that whatever stray dogs you have, you can feed outside the society, not inside the society, so that they don't cause any trouble to the residents. See, not everybody is animal centric, we have to accept that. So if I am there one person who likes dogs in my building, on my floor, if there are 4 families, not the 3 other families may not like dogs. So then that dog becomes a nuisance for them, and obviously that is going to be a point of tension between the neighborhood, right? So rather than go for something that is going to cause tension, feed the dog in a neutral territory, so that the dog is also not going to affect anybody, and the people are also not going to complain, oh, your dog is making a mess and he's barking and you're feeding the dog here and there. So it becomes easy for a peaceful living. Pet parenting is a commitment that you give to the animal for at least 10 10 to 15 years of your life. It's like a child which never grows up. So always think before getting a dog or a cat or any other animal in your life, because that particular soul needs that kind of enrichment, that kind of nourishing, which not everybody can provide. So a dog will need, whether it is small or big, will need some amount of playtime, some amount of grooming, some there will be some health issues, there will be vaccinations, there will be walks, there will be food. So all these things have to be considered before taking in any pet. I do have people coming in before getting a pet and asking me whether we should go in for it and all that, and all the family members have to be on the same page before you get it. Otherwise, mummy ko nahi chahiye and humne kutta la diya, and then it becomes a problem. So rather than go into that kind of a situation, it's better that everybody is on the same page, and then you go in for the correct breed. It shouldn't also be that I want a large dog and I don't have time, and then the dog becomes aggressive or nervous because he is not exercised enough. That shouldn't be the case. Well, we plan to start an in-house facility. We are working towards it. Let's see what happens after that. Thane has been very kind to us. Yes, Thane itself has grown from the time of my childhood to now. It's some places when I go towards Manpada side, I just cannot recognize the area. It's so different now. Sometimes I feel lost. It's so different. But yes, in general, it's grown as a city, and you see a lot of cosmopolitan population here now. Well, it's you can no longer say, oh, Bombay. It's not like that anymore. It's also, oh, Thane. That's good. I like to try all the street food that is there around. Pre-COVID, there used to be this near Hiranandani Meadows, there used to be a lot of stalls put up. So many Sundays we used to just go down and have some dosa or chaat or something like that. Recently we have discovered one Punjabi dhaba named Chariar right here near Bethany Hospital. So we like to go there sometimes. Across our clinic there are a couple of eateries that have come up. Those are also pretty good. One important message that I would like to give all pet parents as such is, whatever is the case, there are good parts and bad parts, but never criticize your veterinarian. That is something that is everybody is trying their level best to take good care of the pet that is in question. And yes, life is fickle, so you don't know what will happen next. But really speaking, everybody is trying their level best. All the veterinarians in Thane, I don't see how they are sincere, and they will be working, trying their level best to work for your animal. So it would be good if people don't criticize their veterinarians on social media specifically. That really gets down people. And we have, in general, if you look at the suicide count in the world, the highest number of suicide count is in firefighters and veterinarians. So yeah, that is something that I would like to put out there.